Hey guys, William here from fitnessforbackpain.com. Thank you so much for tuning in to another episode here on my YouTube channel. Today, we are talking about yoga, a yoga pose, and it's called the child's pose, or the Husqvarna, maybe the Astamanyana. It's one of those, but let's just call it the child's pose because that's what I know it as. Okay, I don't know all the yoga-ish language. So, child's pose. And there's a lot of yoga positions that I don't necessarily agree with when it comes to chronic low back situations. So, if you are a yoga diehard and yoga saved your life, and without yoga 3 times a week, you'd be hopeless. I understand that yoga is massively valuable to people. I'm not here to argue that. I'm here to argue the child's pose with low back pain. Child's pose, low back pain, long-term relief. If you have something against that, let's chat. Let's talk about why I say let's not do the child's pose and let's focus on a few other different areas. If this is your first time here and you're looking to exercise pain-free, that means you've been navigating working out, you want to work out, your doctor has told you to work out, and every time you try to go into the gym, you just get in pain on the way to the gym. Or when you start your workout, you start having symptoms, flare-ups happen after your workout, days after. You have to skip the gym for weeks because you're dealing with chronic pain. I want to show you 5 critical things you have to look at before, during, and after your workout that will massively impact the way you feel. And I'm not talking about short-term fixes. I mean changes that you're going to do to your workout, how you structure it, how you create it, that will give you massive results when it comes to training for longevity and training pain and injury free. The link is below in the description. You can check out the card that's gonna pop up here. It's called the 5 Critical Steps to a Pain-Free Workout. Make sure you check it out. It's 100% free. So let's talk about the child's pose. First, let's talk about the low back, right? The low back is an area that needs stability. The thoracic spine needs mobility. These are 2 separate areas of the spine that require 2 separate things. Yes, moving the low back is great. You see the people doing the cat camels. It's wonderful to get some movement in all aspects of the spine. But when it comes to chronic pain, the low back, we should be thinking stability, not mobility. So what happens is when someone who has chronic back pain, they are searching for relief from the tension, the tightness, the pain, the aches, the sensation of feeling it needs just to be stretched. It always feels tight and stuck and cramped up. These people will find these yoga poses, case in point the child's pose stretch, and they'll do it and it will get relief 15, 25, 30 minutes max, but they have to keep revisiting it. And they start chasing the sensation of this short-term relief, hoping that eventually their body will just kick in and the relief will happen for more of a long-term fix. And that's just not the case. It's not going to happen with this child's pose. So what I want to give you is some reasons for this, what you're going to do instead of the child's pose, and some options that you can do to kind of play around with the idea of what the child's pose is trying to create. So we kind of touched on the child's pose compromising this low back stability, right? We want to create a stable joint. We want to create a stable area for the body to not feel in danger. So with an unstable joint, we have to look at other factors that could be affecting the area that's causing that low back pain. One of them is muscle weakness. Due to fear, due to what your doctor told you, due to what you have told yourself, the narrative you built in your head, you don't move your low back or your spine in general like you used to or like you should. You protect it. You kind of come into yourself and you're not bending as much, you're not twisting as much. You're trying to keep everything close to the chest and you don't want to challenge anything or strengthen anything in the lower back because it could hurt you or it could cause more damage. Again, this is that narrative you built in your head and we have to address that. And so what happens is if you do the, I'm just not going to do anything, I'm not going to strength train, I'm just going to protect it and keep it safe, you're going to atrophy. Your muscles are going to break down. You're not going to be as strong. You're going to lose the endurance and the resilience that you could potentially have in the lower back. You want a resilient, strong spine. The muscles around it is what creates that stability, is what creates that resilience. So if you neglect an area, it will get weak. It will not be as strong and as supportive as it could be. The second factor is fear. We have what's called the protection mechanism. Due to the fear of hurting ourselves, due to the fear of having surgery again because of doing the wrong thing, or whatever your fear is around movement, let's just say it's flexing the spine, due to that fear, your body wants to protect itself, right? The brain body connect. There's neural pathways that are telling your body, no, don't stretch, don't do this, don't strengthen, don't do that movement, don't bend over, whatever you're doing. So instead of, because it feels like it's not stable, it creates its own stable environment, which in return, the sensation of tightness, the sensation of stiffness is what you're experiencing. So it's not necessarily shortened muscles where these muscles are just like, becoming glue and they're not moving anymore. That's not always the case. You're looking at the sensational muscle due to this fear, due to this protection mechanism. And if you want to learn more about that, talk about that all the time. In the description below, you'll see a link that it will take you to a video that talks about the protection mechanism. And the third one, honestly, I think is one of the most important ones, and it's the core strength. And it's not just how many sit-ups you can do or how long you can hold your plank for. It's so much more than that. I like to use the word core coordination, right? The way your mind and body connect together, how it works together, how your core operates and functions during movement, right? And people who have chronic back pain, chronic low back pain, what I have seen, what I saw in my own personal self when I was dealing with chronic back pain for 6+ years, and now what I pull apart and pick out in clients that I work with, is habits around movement, is habits around the way their body chooses to use muscle groups during certain movements. Now, when it comes to the low back and the trunk, a lot of times you hear coaching cues in gyms like chest out, butt out. You kind of get in this anterior pelvic tilt and this chest out because you're trying to really kind of create that tension in that lower back to give you the illusion of more stability. Instead of doing the chest out, butt out, we need to bring the ribs down. We need to brace the trunk, relax the lower back, then go through the movement, right? A lot of times we initiate things like bending over to grab something, picking our child up, cutting the grass, pulling weeds, whatever you do. We initiate the movement in our lower backs instead of our hips and our trunk. So this is how you've been training for years. This is what your high school coach taught you to do. Well, guess what? Now as an adult, as a 25+ year old person, you're gonna have those same habits. You have to recreate proper movement habits, proper core coordination is what I call it. So when you begin to move, when you go to grab something, you don't think, okay, tighten my lower back, get everything super tight, and now my stomach is sticking out and it's super soft. That's a habit, that's a pathway you've created that has to change. Now there's a couple options I like to play with when it comes to getting the function out of the child's pose, right? Some people do the child's pose for that low back gentle pulling. It feels good, it gives them some temporary relief, let's go for it, right? The other reason for the child's pose is maybe some hip flexibility or hip mobility. You spend time doing this exercise to get juicier hips. You want to move better, right? So there's two things you can do. One is I like to use the stability ball. It's very simple. It looks like you're playing on the ball, but it works and it helps a lot if you do it right. The way I try to do it is I'll lay over the ball. I'll go very slow. I'll focus on relaxing my lower back, breathing into my lower back, and doing the stability ball in stages. So I'll lay over it. So I'm trying to create a banana with my spine, and I'll lean forward. So I'll take my weight over my head. The further you go over your head, the more stretching you're gonna get on that lower back. Okay, if you want to back off, if it's getting too intense, if you're just starting to get cramps or spasms, you can back off. You have tons of control. The spine is not in an aggressively flexed position, and you're getting that separation that you might be going for. The second thing for the hips is a very simple mobility drill called the frog stretch. There's lots of different ways you can do the frog stretch that will help you with the juiciness in your hips, but it's a great exercise to do. Some key points on the frog stretch: keep your spine in neutral, keep your pelvis in neutral. Don't try to push past anything and compromise a good position. That's the number one thing. The other thing is just not pushing too hard in general, right? Mobility is something that you have to earn through consistency. You're not gonna get it through a 2-minute hold. You're gonna get it from a 2-minute hold over the next 4 to 5 months, okay? So focus on that if it's an area that you actually wanna focus on. but do it safely, right? You don't have to put your lower back into an aggressively flexed position to bring relief that you're chasing, that the child's pose kind of gives you the illusion of having, because it is an illusion. So that's it. What are your thoughts? Are you an advocate for yoga? Are you an advocate for the child's pose, right? You're my friend. You're my buddy. I don't care if you hate me or hate yoga or love yoga. You're a buddy. If you want to chat about it, if you want to ask a question about it, if you think that the child's pose helps low back pain for long-term relief, I want to talk. Let's chat about it. In the discussion, let me know. Do you think it helps? If it does, let me know your reason below. Open door policy here, no judgment. Again, guys, if this is your first time here, make sure you subscribe to the channel. I appreciate you if you're watching to this point. You are a true fan, and I do this for you. So make sure you hit the bell if you have not already, and be back next week for the next episode.